Hello, how are you? I'm Dr. Saeed, ENT consultant, working in Medcare Sharjah, and Medcare Women and Children Hospital. It's my pleasure to introduce you something about the allergy medication, allergy up to date, what we can present something new just to treat your allergy in the very high standard ways. My subspecialty is sinus and skull-based surgery. We are doing a lot of sinus and skull-based surgery. So we should know that after the sinus surgery, there should be complete treatment. It's not only doing the surgery and that's it. After the surgery, there is a full and long way how to treat the patient from allergy. Either the patient has maybe allergic sinusitis or chronic rhinosinusitis. So in these cases, we offer all the time the patient, give him something is called immunotherapy and sometimes biologic medication. These two treatments are now giving something extra for the patient. They are trying to give the highest standard of life style for the patient. It's not only giving the patient maybe some medication like antihistamine or cortisone. The issue is how to keep the patients happy, how to keep the patients all the time without symptoms of nasal blockage, runny nose, headache, and nasal congestion. Everything should be toward giving the patient the highest level of life style. So this is why I want to concentrate on these 2 points: the how to treat the allergy for long term and how to use this up-to-date treatment, allergy like biologic medication and immunotherapy to treat our patients. Any question, Mr. Akadia? Do you want to ask me some questions
Good afternoon, doctor. Thank you very much for invitation.
Welcome.
I'm sitting on Instagram and in our page. There is a question regarding what is the most common allergies existing so far nowadays. Like maybe there is a name of those allergies or symptoms or.
Okay, the symptoms of the allergy is very popular, very known by every patient. I think nasal blockage, runny nose, itching, and sneezing.
Okay.
When you have these symptoms, you might have allergy. So this is the normal symptoms, but sometimes it's related to something else because allergy is not only in the nose. It might come in the bronchial system. It might come in the skin. So we should know that every patient has allergic rhinitis should be asked about the asthma, the atopic dermatitis, allergic conjunctivitis, and even sometimes the food allergy.
Okay.
So it's like it's atopy, you call it atopy or unified allergy.
Beautiful, doctor. Thank you very much. I have a question now. You say that there is a runny nose and headache, and there is some kind of symptoms, right? Sometimes when we are getting a cold, I think there is a similar symptom. So how to understand that this is allergy and this is cold?
Usually patients know because usually the allergy is chronic problem. If the patients know that every year in this time or every morning he has these symptoms, that means the patient has maybe seasonal allergic rhinitis or maybe like permanent allergic or perennial allergic rhinitis. Very rarely the patients come to us and get maybe he has some flu and there will be some confusion between the flu and allergic rhinitis because the flu is usually very acute, maybe sometimes high fever, and it's like fatigue. Everything is different from allergy.
Okay, beautiful. If we're talking about the season allergy, right? Some people they have it like every 3 months, I think, right? So what can be how it can be predicted or how we can stop that? I mean that if there is a medicine right for that season, or I'm talking about the medication at the moment, doctor.
For allergic rhinitis, the treatment of allergic rhinitis is very variable and individual.
Okay.
If we want to separate, maybe you can say this is the allergic rhinitis, seasonal allergic rhinitis, and perennial allergic rhinitis. Here in UAE, most of the cases, you can say maybe 90% of the patients uh, have annual, or you can say perennial allergic rhinitis. It's not only in the maybe in autumn or in winter, or in any specific time in the year. Why? Because here in UAE the plants or the pollens which comes in very specific area is very very rare, and we can find it especially in some places in maybe in Dubai, in Abu Dhabi. But in general, most of our cases are perennial allergic rhinitis, and most of the time is maybe house dust mite, sometimes fungus, sometimes a cat or something else. But the first thing is try to avoid the trigger.
Okay.
If you know that maybe you have allergy maybe from cat, it's very easy. Don't bring cat to your home.
Okay.
It's very easy. If you have allergy maybe from house dust mite, this is of course it's like a great issue, and we should have a lot of procedures. We should clean everything in the house. If there's any curtain, mattress, everything should be clean. Sometimes we should bring specific kinds of carpets, of mattress. All of these can make some improvement, but sometimes even with all these issues we cannot control the allergy from house dust mite. So we should do something else, like giving the patients medication. I think most of the people, they know what medication, antihistamine, with all categories, and the cortisone spray. Those are two principles in our medication: antihistamines like Aerios, Zyzal, Zyrtec, all of these, and the cortisone sprays, Avamys, Nasonex, and all of these medication. This is the first step of allergy.
Okay.
The first one is avoidance and medication. The second one, if there is no improvement, okay, then we can go to the next step of either the immunotherapy or the biologic medication. The immunotherapy, as I told you, is trying to exactly define what is the allergen by doing the prick test or by blood tests. We have a lot of tests to define. And the second, and when we get the definition of this substance, we can give the patient this treatment gradually. We give him either sublingual drops or subcutaneous shots, and slowly we'll increase the dose slowly until the body adapt to that, and this will give the patients very beautiful improvement with no side effects. The problem of this treatment, it should continue maybe for 2 years to get the highest result of efficacy. And I advise it, and I'm doing a lot of cases. I have very great number of these patients, and you can say 80%, according to the studies, or 80% of patients are very happy with this treatment.
That's beautiful. It's good to know. Doctor, one of our viewers asking a question: how long can allergy last? So I think he's trying to say that the period of allergy should be. What do you think?
At the beginning, allergy can start anytime in your life. It can start from day one and start maybe if you are maybe 80 years old. And it can also last for undefinitive time. It might sometimes maybe continue for maybe 1 hour, and sometimes all your life without any stoppage. So it's something very variable,
Dangerous
and we cannot anticipate. Of course, we have a lot of treatment, but how to anticipate is something we cannot anticipate it.
Okay, beautiful. Doctor, I have a question. I faced in my life that someone have a blocking nose. You know, the nose is getting blocked, and they're thinking that it's or maybe allergy, or it's maybe cause of cold or something, and they're using the nasal drops. And there is, I think, a days we have to use, and from the medicine, we have a medical allergy too, right? As I'm not making a mistake. Can you give a bit brief about the situation too?
About
medical allergy.
This is very difficult term, especially here in UI. We have a lot of patients every day come with something is called rhinitis medicamentosa, or medical rhinitis, and it's triggered by very specific names like xylometazoline or nafazoline or all of these drops, and this is vasoconstrictor for the nose. If you are taking it more than 5-6 days, it will give you very severe reverse reaction. If you want to take it for making your nose open after 5-6 days, you cannot leave it, and you should take it every time, and it will be addiction. Exactly like the addiction. So we advise the patients, and we recommend, please don't take this medication more than 4 or 5 days, because at the end maybe you will need a surgery to get rid of.
Okay. There is another thing, if we're talking about now allergy and medication and everything, right? So if we have an allergy, right, and we're we're saying, okay, it will go, so, like itself, it will leave me. And if we will leave allergy untreated, what's gonna happen if we're not paying attention to that, right? Do we need to go to doctor? What is the process of this moment?
See, allergy is a very difficult disease because, many patients, maybe especially here in UI, there's maybe I think 30-40% of patients, maybe they will experience some kind of allergy in their life. Sometimes more, sometimes less, according to the area. But it will affect your normal life. Patients come to us maybe every day. Patients, I have severe allergy, I cannot go to work. I cannot study well. This will affect your life. Maybe it will not need every time to take medication, but it's like a big effect on your life, on the work, on your social life. So in this case, I advise the patients, even if he doesn't have that severe allergy, but it affects his life, go please to the doctor and take some medication. Sometimes by small medication like antihistamine, cortisone spray, it might be okay and no need to something else. Sometimes you need something extra like immunotherapy or biologics. So it's really not easy disease at all.
Okay. Doctor, there is a question, one of our viewer asking again. Thank you very much for being active. It's really, really impressive to make a communication for you. Is there a difference between treatment, the young generation, older generation, adults? Is there any different the treatments or pre-treatments of the allergy?
Of course. For kids, for small ages, we recommend the patients to be treated more aggressively than like the adults, because if the patient has severe allergy, if you are a kid, sometimes, especially if there is big turbinates because of the allergy, it will affect his breathing more than adults. So in this case, it sometimes affects maybe her normal concentration, his normal concentration. So we advise the people, the small ages, to be treated more aggressively than adults. All of the people should be treated, of course, but we concentrate more on the small ages. And for the immunotherapy itself, especially for the kids, we advise it more than adults. Why? Because it will avoid us from getting asthma in the future. As I told you, asthma and atopic dermatitis, allergic rhinitis are all, like you can say, the same entity. So if we treated the small kid with immunotherapy, it will avoid him to get asthma in the future. And this is very big impact, very big reason why we try to push for immunotherapy, especially for the kids.
Okay. For immunotherapy, is there any time, or any periods we have to come and visit doctor?
Previously, you can say the threshold of getting the immunotherapy was very high. That means if the patient has very severe allergic, intractable allergic rhinitis with no improvement by any medication, in that time, we'll tell the patients go and take the immunotherapy. Nowadays, because it's now very accessible and it's now long time tried, and the efficacy is very high, we can say even for the moderate cases of allergic rhinitis, you can take the immunotherapy. Because as I told you, side effects, if you compare to the medication, is very less. You can say for the drops, there's no side effects. Even
Okay.
for the skit, if you skit to, that means the shots of the
Okay.
immunotherapy, it's also very less. So we advise, if the patient even has moderate allergic rhinitis, not severe, we can start the immunotherapy.
Okay, that's beautiful. Doctor, in case if we have example, let's just move to the food allergy, because as we're living in an international country, let's say there is a different type of food. So if I have a food allergy and I don't know the cause of it, okay, I have to go immediately to doctor. What will be this?
Food allergy is something also very critical issue, because a lot of maybe children die around the world because of maybe peanut allergy.
Yes.
So, food allergy, if you have any history of food allergy, I'm talking about real allergy of food, that means anaphylaxis shock. In that time, you should know exactly that you have maybe allergy from this issue exactly, and you should avoid it. Sometimes you should, especially for the children, put some information that you have this one. And sometimes you should have in your home the EpiPen to avoid any maybe anaphylaxis shock. So food allergy is very important, and if you have any history, you should know. We have a lot of tests for that. We have the food allergy panel. We can decide exactly what he has allergy. It's not all the time very accurate, but according to the history and to the test, we can maybe get some information. And as I told you, it's very important. Sometimes there is something is called food intolerance, which is a little different from food allergy. Food allergy means IgE mediated. IgE mediated,
Okay.
that means very active reaction. But otherwise, food intolerance means that IgG, most probably it makes some fatigue, headache, sometimes very ambiguous symptoms. In this case, we do the IgG food test, and we define maybe the patient has some problem with gluten, with strawberry. In these cases, also we try to avoid it. Still under investigation, we can say, the treatment for food intolerance test, because there's not too much study. There are some studies, but it's not approved or not like evidenced like the food allergy. This in general. This I want to mention now, there is immunotherapy for food allergy.
Oh,
Yeah,
okay.
and there are some items now in the market for food allergy. Especially for peanut, because this is the most common food the patients has allergy from. There are some companies, they started without maybe evidence-based medicine for food allergy, but what is evidence-based medicine now is the peanut allergy, and the patients can take it, the extract of peanuts slowly until he adapt to that, and this of course will save a life of many children.
Okay. One of our viewer, I think he's sharing a part of story that unfortunately in his memory has that from that peanut allergy there was a death.
Yeah.
So
Unfortunately.
because they couldn't treat it in right moment and right things. Okay, I want to, like in a short period, doctor, you can't, of course we're trying to combine all the topic in one our time manner. Yeah. So are stress can cause allergy or not?
Okay, there is something is called stress-related allergy.
Okay.
Okay, and
Okay.
and even for these cases we have specific kinds of treatment like
Okay.
hydroxyzine, of course. So I advise every patient to avoid stress, but it's not easy all the time. But yeah, there is some kinds of allergy like induced by the stress.
Okay, doctor, I heard the story before that some people they have allergy to water. Some people, they have allergy or allergic reaction to the ultraviolet or to the sun, and sometimes they can't go out, or they can't go and make some hygienic procedure and things. In this case, there is any new nanotechnology to help those people, or?
See, I will tell you something. In our practice nowadays,
Yes,
we
doctor.
have 4 families of substance for allergy.
Okay.
We have the house dust mite, and we have the fungus,
Okay.
we have the pits,
Okay.
and we have the pollen. Those are 4 families which we are dealing with them, and we are giving the immunotherapy for them. Other kinds of allergy, we call it usually irritative rhinitis, or
Okay.
something more like making more reaction, more than it's the cycle of allergy or the normal process of allergy. So for these cases, I think it's very individual, and we should check every patient individually.
Okay, that's beautiful. If we're talking allergy in general, what you can suggest to our viewers for the first aid, or for how to treat in this or that situation?
My suggestion is not to say that there is no cure for allergy, because I can discuss with many of my friends and my patients. They will say, okay, doctor, there is no cure for allergy. I can tell you, I cannot say that there is complete cure for allergy. But in my experience, my daily experience, the patients who are taking immunotherapy, or even the patients who are taking the biologics for the very, very resistant cases of allergy, they are living very normal life.
Okay.
So don't say like allergy, there is no treatment for that. We have a treatment for all the level of the allergy, from the mild, moderate, severe, and
Okay.
very severe, and whatever the level of the allergy, we can deal with it.
Okay, that's beautiful. So, if about the pets, I had the pets. Unfortunately, I got an allergy. Even I just had him for a long time, and time period came that I had an allergy. So I didn't know what to do. Of course, we get rid of the cat because
See,
it's
we are facing this matter maybe too much times. The patient he loves his cat, and he cannot
absolutely.
leave it. What we can do? Very easily. I have one of my close friend. He had the same, and he told me, I cannot leave my cat. It's very, very precious for me. So in this case, we can give the patients immunotherapy.
Okay.
Some drops every day, 1, 2, 4, 8 drops every day. Gradually we increase it, and the patients, after 2 years, the patients with the first 1 to 2 months, he will feel too much difference, and after that he will continue for this treatment, and he will be okay, and there is no recurrence for that for the 5 to 10 years.
Okay.
Basically. So even if you love your cat and you want to continue, if you have allergy from, you can take the immunotherapy, and it will control
This
your.
was the main question. I wanted to use the chance now to ask, like, is there any chance I can keep my cat?
Yeah, I
And
told you.
plus live with my cat? Maybe there is some treatment. So you
As I
answered the
told you.
question. It's
Yeah, it's
amazing.
very easy, but you should at first do the test, either the prick test or the inhalant panel test, the blood test, and define you have allergy. In addition to the story, okay, that means you have allergy from cat, so we can prescribe either the drops under the tongue, or
Okay.
even the shots. In these cases, you can treat your allergy, and no need to throw your cat, of course.
Okay, that's beautiful, doctor. Not last, like, I have a question which I was also facing couple of, and I received the question actually, and I remember the story that there was an old woman, like in latest her age, so she had an allergy from anything around her, let's say medicine, because we need to treat and things, right? So in old age, we have to try to a bit keep it back, I think, right, when we're treating the our oldest people.
Yes, I will be very specific. Like, I know that some people say, they are saying, okay, I have allergy from everything. It's not exactly the term I have allergy from everything.
Okay.
If you have allergy, you should have a proof. You should do the prick test or the blood test to know that you have this allergy from.
Okay.
In many times, if you are maybe smelling something irritative,
Okay.
maybe paint or maybe very strong perfume, okay, I have allergy from perfume. No, this is not allergy from perfume. You have maybe level of allergy, and this will irritate your nose more. But this is
Okay.
not called allergy. It's called irritative rhinitis,
Okay.
and it's not allergy.
Okay. So here I want to say thank you very much, doctor. It was
Thank you.
really interesting to talk. I want to
you so
thank
much.
all our viewers for their being engaged and for the question they asked. So, doctor, if you want to say something, please.
Thank you so much for your presentation. Just the last word I want to say, there is, okay, it's not complete cure for allergy, but you can continue your life very easily with the new treatment of immunotherapy and biologic medication. I think I talked too much about the immunotherapy, but the biologic medication, which is now very up to date, and it's very like magnificent medication for many kinds of disease, either allergic rhinitis, atopic dermatitis. We are using these new molecules. We call it monoclonal antibodies, like dupilumab, omalizumab, and others. These are the new future of our treatment, and thank God we have a very beautiful, successful stories of treatment for patients who are like suffering too much time from allergy. So this is what I want to tell you. There is, I don't want to say cure, but you can continue your life very easily with the new treatment. Thank you so much.